Okay, I'm going to go over posterior ribs. So posterior ribs, we're going to do a unilateral upper oblique, and then a lower below the diaphragm. So the first thing that I'm going to do is get my patient changed. They're going to, again, take everything from the waist up off, including bra, necklace, or any jewelry that they might have. Gowns are tied with an opening in the back. With ribs, you want to ask your patient if they had an injury. If yes, have them point to where it's at. Sometimes facilities will use like what's called a obliquely marker. It's a little metal BB. You'll stick that wherever the pain is on the patient's skin. Have them do it. If they had an injury, what happened, how long ago. With ribs, we also want to ask if there's any difficulty breathing, just because a rib may have broken and punctured a lung. So it's really important to make sure that they aren't having any trouble breathing. We're going to put the machine in transverse detent. We are going to use a 40-inch SID for these. And for the upper ribs, we're going to use a 14 by 17 lengthwise. So we want to make sure that we have the entire length so that we can try to fit all of our ribs on one image. I'm going to have my patient stand with their back up against that board because we're doing posterior ribs. So the posterior side is going to be up there. We're going to do right side. So what I want to do is center 3 to 4 inches inferior to the jugular notch. So jugular notch, I want to go about 3 to 4 inches inferior to that. And I can even go a little bit lower as long as I still have light above the top of the shoulder. So I might go down just a little bit. I also want to center midway between the mid-sagittal plane and the lateral border of the patient. So I'm going to have my patient move to the left just a little bit. Good. I'm going to sneak around you here. I'm going to lower this board down beside you. And I want the patient's arm out of the way so it doesn't end up in the x-rays. You can have them extended out or put it on their hip where it's going to be nice and low so it doesn't end up in the anatomy. So midway between the sternum and the lateral border. And I would have my patient hold nice and still just like that. And I want to expose on inspiration. So take in a nice deep breath for me and hold it. And then you can breathe. I'm going to have my patient stay just like that. I'm not going to change my height right now, and I'm going to oblique them into a 40-degree oblique towards me. I'm going to roll you this way just a little bit. Good. I want to keep their hand out so that it doesn't end up in the anatomy. I'm going to center a little bit more towards midline, still at the level of 3 to 4 inches below the jugular notch. I want to make sure that I'm going to get the lateral border here. And I would have my patient, again, take in a nice big deep breath and hold it. For the lower AP, I'm going to have my patient put their back up against that board again. I'm going to change to a 10 by 12 crosswise. I'm going to find the patient's iliac crest. I'm going to feel on your hips. And then I just want to bring my tube down until the bottom of my light is at the iliac crest, okay? This board's going to move behind you. And then I'm going to make sure that, again, I'm centered between midline and the lateral border. So I'm going to move her just a little bit to the left. And then I'm going to put my marker right down here in that bottom corner. So for these ones, the breathing's a little bit different. We want to move the diaphragm up out of the way. So we do them on expiration. So take in a deep breath for me, blow it out, and hold it out. And then I would expose. And you can breathe and relax.